In this presentation, I am going to go over the hormonal and cellular regulation review. This is our Adult Health 1 exam number 3. The first question I have is, what labs are used to evaluate hormonal function? Well, there's actually several of them. We look at hormone levels, um, which are generally just a blood test that we can pull in order to evaluate those hormone levels. Like, for instance, ACTH, adrenocorticotropic, is a hormone that is used to evaluate for things like Addison's disease. And then for things like thyroid disorders, they're evaluated by blood test, the thyroid stimulating hormone, which is the TSH, free and total hormone thyroid hormones, which are the T4 and T3. We can do the stimulation and suppression tests. We can look at imaging, and we can also do biopsies, which will give us an indication of what's going on with the hormonal function. What factors can increase glucose levels? There's actually several. So carbohydrates, depending on upon how much of carbohydrates the person is consuming in their diet, lack of activity makes the body less sensitive to insulin. Stress, like emotional stress, and I mean, like, it could be life stress. So things like financial stresses, maybe marital stresses, child stresses, things like that, anxiety and pain. They can have poor sleep, can also impact it. So the body uses insulin less effectively when they have poor sleep. Steroids, so certain medications, the side effects of those medications, corticosteroids that we've talked about, dehydration, not taking enough medication, illness. When the body is sick, it releases hormones that increase the blood sugar. And then, of course, we have something called the dawn phenomenon, which is the surge of hormones that naturally occurs in the morning, causing blood sugar to spike before getting out of bed. So, what is a complex physiological process with integrated responses involving various glands, hormones, and the action of hormones on the target tissues? Well, this would be a direct definition of hormonal regulation. It is the physiological mechanisms that regulate the secretion and action of hormones associated with the endocrine system. If I haven't told you before, I highly recommend that you look at your Giddens textbook and at least review the concepts that we're covering, the hormonal regulation and the cellular regulation. So, who is at risk for problems with hormonal regulation? Well, the reality is it's everyone. All individuals of all population groups can have problems with hormone regulation. It isn't just one particular population, it literally is everyone or anyone. So, should it be expected that all older adults are anemics? No, it's not a normal aging process, and this can lead to serious complications. So, so experiencing symptoms like fatigue, weakness, shortness of breath should be further investigated. We shouldn't just chalk it off to the fact that they're older adults and this is a normal aging process. So you should understand what the rule of 15 is that we utilize to treat hypoglycemia. So what is it? A blood glucose value less than 70 is treated by ingesting 15 grams of simple carbs. So they're fast acting carbohydrates, such as 4 to 6 ounces of fruit juice or a regular soft drink. Commercial products such as Gelatins or tablets containing specific amounts of glucose are convenient for carrying in a purse or pocket to be used in such situations. We recheck the blood glucose 15 minutes later. If the value is still less than 70, we give the patient more, 15 grams more of carbohydrates, and we recheck the blood glucose in 15 minutes again. If no significant improvement occurs after 2 or 3 doses of 15 grams of simple carbohydrates, we need to contact the healthcare provider. So, what are macrovascular complications of diabetes? Well, these can be cerebral vascular, they can be cardiovascular, and they can be peripheral vascular disease. And then we also have those microvascular complications, and those include retinopathy, nephropathy, and neuropathy. Remember that it is really important that we teach patients about some preventative things. So, as far as the macrovascular complications, uh, when it comes to retinopathy, we would want to make sure that we educate patients about keeping up with their yearly eye exams. And like I said in the lecture, oftentimes it is the yearly checkup that people do for their eyes that the eye doctor will say, "Hey, I'm noticing some changes with your eyesight and the retinopathy potentially. Maybe you need to be evaluated for diabetes." So these are some of the macrovascular and the microvascular complications that do occur with diabetes. So, what are some signs and symptoms of hypoglycemia? This would be a blood sugar less than 70, right? So, they could have irritability, blurred vision, their cold and clammy skin, tachycardia, unsteady gait. They can have confusion, anxiety, pallor, shakiness. Remember, cold and clammy, get me some candy. So that candy will help to increase the blood sugar. So there are various types of insulins that we can give. There's rapid acting, short acting, long acting, right? Lispro is one of them. What is the onset time of Lispro? Well, it's about 15 minutes. So this is usually one of our rapid acting insulins or short acting insulins that we give to patients. And we primarily give these before a meal. So, this is really important that we know the onset time so that we can gauge it according to when food is going to be delivered on your unit. If it's going to be a significant period of time and you need to give the patient the medication that has a quick and rapid or short acting onset, that we need to give them some type of snack or carbohydrate so that they don't, in fact, end up being glycemic. I highly recommend that you review the table on page 1291, and that is a table that shows the onset, peak, and duration of the various types of insulin. So, on the flip side, what are the signs and symptoms of hyperglycemia? Well, they could be blurred vision, weakness, headache, nausea and vomiting. They can have increased urination, increased appetite. Remember, hot and dry equals sugar high. So, what procedure is used to remove peritoneal fluid from the abdomen? Well, this is a paracentesis. When a patient is going to have a paracentesis, it's important to have the patient void before the procedure. This is to ensure that the bladder is not perforated during the actual procedure of the paracentesis. We would have the patient in a high Fowler's or sitting on the side of the bed. After the procedure, we would want to make sure that we monitor for hypovolemia because remember, the patient has actually been accustomed to this additional fluid. So when we pull this large amount of fluid off of the body, then they run a chance of having hypovolemia. They could also have electrolyte imbalances. We'd want to monitor the blood pressure, the heart rate, and then, of course, because we are inserting a needle into the patient, we need to monitor the dressing for bleeding and any type of leakage. So it's important that we continue to do those assessments. And of course, because we've had we've gone into the patient, right? So there isn't now an opening. They're also at a higher risk for infection. So we want to monitor for those signs and symptoms as well. So, what diabetic medication should be held for 48 hours following a CT with contrast? Well, this would be metformin. We hold metformin when a patient has a CT with contrast to protect the kidneys. Metformin is cleared through the body by the kidneys, so we need to make sure that there isn't any injury or anything like that because the patient is getting a CT with contrast. So it is important that we hold that medication 48 hours following a CT with contrast. So, what is the recommended diet for patients with cirrhosis? The diet for the patient who has cirrhosis without complications is high in calories. It is high in carbohydrate content with moderate to low levels of fat. Protein restriction may be needed for the patient right after a severe flare up of symptoms like hepatic encephalopathy. A diet of 3,000 calories or more per day may be recommended depending on the patient's weight and condition. Protein is needed to promote healing and maintain muscle mass. 1.2 to 1.5 grams per kilogram per day of protein is encouraged unless the patient has severe hepatic encephalopathy, in which case protein intake may need to be temporarily reduced. A low sodium diet, if a patient has edema or ascites, usually 2 grams of sodium per day. Patients should be advised to avoid processed, canned, or salty foods because, of course, we know that where salt is, water is. So it would increase the amount of edema or potentially ascites the patient has. What is the complication that type 1 diabetics are at risk for? Well, it's DKA, diabetic ketoacidosis. It is a profound deficiency of insulin. When the circulating supply of insulin is insufficient, glucose cannot be properly used for energy. To compensate, the body breaks down fat as a secondary source of energy. This is why the patient will usually have ketones in their urine. So, what are some of the signs and symptoms of DKA? Well, Kussmaul's breathing, right? That rapid, accelerated breathing. Acetone breath. It'll be a sweet, kind of fruity breath. Abdominal pain. Those three cardinal P's: polydipsia, polyphagia, polyuria. I eat too much. I drink too much. I pee too much. They can have lethargy, weakness, dry mucous membranes, tachycardia, and orthostatic hypotension. Which medication is the drug of choice for hypothyroidism? Levothyroxine, Synthroid. That is the medication that we primarily see patients who have hypothyroidism are on. Remember that this medication needs to be taken first thing in the morning. It needs to be taken by itself without any other medications, and they should not eat or drink anything other than water uh, at least 30 minutes to 45 minutes after taking the medication. What nerve damage occurs in diabetic patients that can lead to the loss of protective sensations in the lower extremities? Well, it's diabetic related neuropathy. It is one of the most common chronic conditions of diabetes. It occurs primarily due to the long term exposure to elevated blood glucose levels, which leads to the nerve damage over time. This is why we tend to really educate patients, one, about foot care, diabetic patients about foot care, inspecting the feet, keeping the feet dry, not putting lotion in between the toes, not doing their own clipping of the toenails. Don't go get pedicures because it can cause the potential for the open wounds because they don't feel it. They don't have the sensation. They can walk around for weeks with a piece of glass shoved in their foot and not really know it. So, diabetic neuropathy, one of the most common conditions, and it's because of those elevated glucose levels that cause the nerve damage from long term complication. So, what are the most common infiltrative emergencies? Well, it's cardiac tamponade and carotid artery rupture. Both of these are life threatening, infiltrative, on oncology emergencies that occur in patients with advanced cancer or tumors involving the head or neck. Cardiac tamponade is, like I said, a life threatening. It's compression of the heart that occurs when fluid accumulates rapidly in the pericardial sac, preventing the heart from filling and pumping effectively. Carotid artery rupture is a catastrophic hemorrhage that can occur when a tumor in the head or neck erodes into the carotid artery or when prior radiation or surgery has weakened the vessel wall. These are both very much emergencies. They are a code, you would call a code. Um, the mortality rate of these patients is very, very high. So, what is the primary function of cellular regulation? Well, it maintains homeostasis. Cellular regulation refers to all functions carried out within a cell to maintain homeostasis, including its responses to extracellular signals and the way each cell produces an intracellular response. Normal cellular reproduction and growth is a precise, error free interpretation. There are a host of surveillance mechanisms that are present to recognize the error and repair the mistake. Again, I will tell you to refer to your Giddens textbook and review hormonal regulation and cellular regulation sections of that book. So, what is this emoji effect? Well, it happens when a hypoglycemic episode overnight leads to a hyperglycemia in the morning due to a surge of hormones. I would make sure that I understand the difference between a dawn phenomenon and a Samoji effect. What are side effects of chemotherapy agents? There's a lot, right? Anorexia, nausea, vomiting, alopecia, leukopenia, infections, reproductive problems. Chemotherapy agents can destroy healthy cells too. Remember that. They do not have the ability to say, "Oh, you're a good cell. I'm going to leave you alone. You're a bad cell. Let me attack you." Right? So this is why it actually causes a lot of havoc on patients, especially with their immune responses. So the nurse should monitor the CBC, especially neutrophil, platelet, and RBC counts. How can the nurse help the nutritional intake of a patient with anorexia due to chemotherapy? Well, we can increase the nutritional density of foods by adding high protein in our calories. This is where we use like peanut butter. We could use um, like milk, cheese, honey, brown sugar, um, Ensure, Boost, protein shakes. We really have to tailor this to the actual patient. It's very individualized. What will they eat? If a milkshake is something that they can tolerate and they love, let's give it to them because we're going to get um, many more calories, right? And it's a small amount. And if they like it, they're encouraged to eat it. It is very difficult, and we do have a problem with anorexia in our chemotherapy patients, especially because of the nausea and vomiting. So we want them to eat when they're less nauseous. We can give them antiemetic medications to try to help with some of that nausea so that it encourages them to eat a little bit better. But finding foods that they love, that they enjoy, that they are willing to eat, it really does help. But the more bang for our buck, butter, margarine, peanut butter, honey, brown sugar, and those protein shakes are just super important. So, what are risk factors for cancer? Well, exposure to carcinogens, smoking, radiation, obesity, sedentary lifestyle, aging, genetics, viruses. So, some teaching points on cancer prevention would be the preventative screenings, the pap smears, the colonoscopies, the mammograms. Um, the use of sunscreen. Make sure that they're using an adequate SPF over 30 so that they can help to keep from a lot of those UV rays, right? No tanning beds. Like we should really teach people about not using tanning beds. Smoking cessation, doing those self examinations, male and female. For males, the testicular, and for women, the breasts. Um, Eating a healthy diet, having an active lifestyle. We can teach the patients, even the community about warning signs of cancer. And if you remember, I used the acronym CAUTION. It's on tables 16. It is on table 16.6 on page 273. And remember, with early detection and prompt treatment, we have much better patient outcomes. So, what's an important teaching point for a patient taking SSKIs? Well, we need to protect those little teeth, those little pie biters. Sip the medication through a straw to prevent the staining of teeth. So, it's very important that we provide that patient teaching to them regarding them taking SSKIs. So, what medication is used for patients with cirrhosis that acidifies feces in the bowel and traps ammonia, causing its elimination in feces? Well, this is lactulose. Lactulose helps to remove ammonia from the blood. Patients don't always love this, but it's important that they take this medication because they need to rid the body of this excess ammonia. The liver is what normally converts ammonia into urea, which is then excreted by the kidneys. In cirrhosis, the damaged liver cannot effectively remove this ammonia from the blood. That ammonia then builds up in the bloodstream, and the elevated levels can cross the blood brain barrier and affect the brain function. So this leads to the hepatic encephalopathy. Lactose helps to remove the ammonia through the GI tract. So if a patient has hepatic encephalopathy, we're going to give them lactulose so that they can drink it to help remove this excess ammonia. And the way that we would know that this is effective is because they would start being more alert and oriented, right? Less confused. This would be a great way of evaluating if the medication is working or not working. All right, so I just have a few final thoughts to help maybe guide your preparation for the exam. I think it would be important for you to review the diagnostic criteria of diabetes on it's page 1289, table 53.2. There is specific criteria that I just want you to review before the test. Um, I want you to also revisit a little bit about um, uh, a parothyroidectomy, that procedure. So, removing the parathyroids. Remember that patients who have a parathyroidectomy may experience hypoglycemia. So, it's important that we monitor calcium levels diligently in these patients because we know that the parathyroid has a lot to do with our calcium levels within our body. I think it's important for you to also review um, a bone marrow biopsy. And what I mean by that are your nursing interventions. What do we do for a patient who has a bone marrow biopsy? Sometimes we're monitoring them, right, for bleeding, for infection. We are If they are bleeding, we can always lie them on that side where they had the biopsy, where we've gone into the iliac crest. Um, we can have them lay on that, but we should make sure that we continue to do our diligent assessments, making sure that the bleeding is indeed under control, that the patient isn't continuously bleeding. So we need to make sure we do that. But please review your interventions with that. I also want you to think about the classifications of obesity. So a BMI less than 18.5 is underweight. 18.5 to 24.9 is normal. 25 to 29.9 is overweight. And anything, and if they have a BMI over 30, that is considered obesity. So I want you to review those classifications. Um, I also want you to review the medications for a thyroid crisis. So, methimazole is a medication that's used, and um, we give that to patients. And then whenever we give medications, that would be a collaborative intervention. We always want to make sure that we know what we're going to do to evaluate whether or not the medication is effective. So in this case, because it has to do with a thyroid, right? Thyroid crisis, uh, hyperthyroidism, we want to evaluate the T3 and the T4 labs to see if the medication is actually working. Uh, I want you to take time to review the worksheet that we completed in class and went over on hypo and hyperthyroidism. Just review the two sheets. It kind of gives you a brief overview of the two. And the last thing I'm going to say is please remember your ABCs: airway, breathing, and circulation. Oftentimes, when you're answering questions, these three ABCs do apply. And if you put that into play, it often leads you to the correct answer. So, as always, if you have any questions as you're getting ready for uh, your test, you're more than welcome to email me. I'm more than happy to answer any questions that you might have. But I felt like this review gave you a pretty good overview of many of the concepts and the areas of the concepts and exemplars that you'll be tested on. Thank you.